University of Aga Khan, Karachi, Pakistan. Firstly, I will introduce our guests, Dr. Umair, Shoukat, Dr. Rashna, and Dr. Mubassar. Thank you very much for joining us, and I apologize if I didn't pronounce your surnames correctly. I'm Dr. Sukhia, the head of Department of Orthodontics, and we are so honored to have you here with us. My young, talented colleague, Dr. Ali Keshwal, is going to help me to moderate the journal club. So, Ali, good morning. Is there anything you want to share with us?
Thank you so much again. I'm really happy and enthusiastic to host this program. This is the first online journal club of Orthodontic Department of Tehran University of Medical Sciences, and we are really happy to have professors of Aga Khan University with us to share the one of their last published articles in American Journal of Orthodontics and Dentofacial Orthopedics. We host Dr. Rashna Hoshang Sukhia, Dr. Omar Shoukat Ali, and Dr. Mubassar Fida from Karachi, Pakistan, and this is all. We are all ears and impatiently waiting for the precious lecture of our dear colleagues. Dr. Sukhia, it's up to you. We are listening to you.
All right, thank you very much for inviting us to your first Orthodontic Journal Club, and it is our pleasure to join you today. So we will start off with just a brief introduction, and then I'll pass it on to Dr. Umair Shoukat, who will explain the article in further detail. Okay, so this was a cross-sectional study that we carried out here at the Aga Khan University Hospital, Karachi's dental clinics. And it was titled Influence of Incisor Inclination and Anterior Vertical Facial Height on Facial Attractiveness in an Adult Asian Male. So the background was that, as everyone is aware, that facial proportions and facial soft tissue profiles vary in different populations. So that is why we wanted to see what is the influence and what is the perception of our people on an Asian adult male profile. And when we change the inclinations, when we change the anterior vertical height, does that have any effect on the aesthetic scores that the individuals give? So we had three groups of raters. We had general dentists, we had orthodontic residents, and we had laypersons. And we changed the lateral profile view of the face of an adult Asian male, and we changed the incisor inclinations, and we changed the lower anterior facial height. And these were then rated by these raters, and we compared the results amongst them. So, so now I would invite Dr. Umair Shoukat to take you through the article.
Thank you so much.
Dr. Umair.
So this article was done as told by Dr. Rashna, that to understand the perceptions of different raters. We have three different raters, which include orthodontic residents, laypersons, and general dentists, to understand better acceptability overall in our community. So if we start from the introduction involves the review of literature, which involves slightly, if you go down. So this article actually dictates what already is happening in the literature. Number one, starting from the adult orthodontic patients, anticipate improvement not only in masticated function, but also in facial attractiveness. So overall, the importance of what we are doing, we have emphasized on that. So I just want to go through the introduction slightly, then we will discuss the material methods and the results. So coming towards that, as the people mature, we all know that they develop a sense of perception from different sources, which includes family, friends, and the media itself. And these perception becomes a driving force for patient to seek orthodontic treatment. So orthodontic treatment that meets this perception of the patient can be considered successful. Apart from that, a study which was conducted by Wild et al. Showed that the mouth is the most observed area. In orthodontists, you know that after eyes, mouth is usually the area which makes the person most attractive. So apart from that, it's also important to have a good pleasant communication. So overall, the mouth, smile, and teeth actually helps you with that. So orthodontists are in the ideal position to help one achieve these desired aesthetic smiles and fulfill their demands to improve facial attractiveness. So coming forward, one of the features that better appreciated and contribute to smiling is photograph is the buccal inclination of the maxillary incisor. So as we all know, during finishing our cases, one of the key aspects is the buccal inclination of the central incisors, which can actually help to improve your smile overall. So therefore, improving the maxillary incisor inclination to cephalometric norms is critical in treatment planning to obtain good facial outcomes. So lower anterior facial height has an impact on profile attractiveness. There are multiple studies which have been done in different communities, for example, in Brazil, Asian population, European population, in which they are looking to see which lower anterior facial height is the best. So there's abundance of literature present already, and this our study actually adds to the literature. So just coming to the introduction again, lower anterior facial height is an important aspect of your facial attractiveness. And recently, a study showed that a long face subject had lower static score when compared with normal and short face subjects. And usually, this is what we see in multiple studies, that a longer facial height patients usually are not considered very attractive. Apart from that, vertical tendencies always played a role in predictability of treatment outcome. We know how relapse can occur in vertical dimension. With the introduction of temporary anchor devices, orthodontists have improved modalities to control vertical growth tendency. We know after that, we can actually improve a lot of things with the help of different mechanics involved in orthodontics. So then multiple studies, we have given reference for the multiple studies, what they have.
Excuse me, dear Dr. Shoukat, we lost your voice. We cannot hear your voice.
Now?
Is it better now?
Yes. It's clear now. Thank you.
So the multiple studies have been observed the impact of various maxillary incisor inclination and lower anterior facial height combination of facial attractiveness in female subject. So one of the studies was done in female subject. Majority of the literature what we have gone through is done on female subjects. So I feel that this was important to cater the male subject as well and see what are the different impacts of that. So limited data exists on the impact of facial attractiveness in male subject. This is what we have mentioned. So in addition, previous studies have not reported the impact of smile on varying lower anterior facial height. So smile might have an impact on different facial heights. So this was the idea to understand that if smile can actually alter the perception of different panels of data. So this was the idea behind this study. So the objective of this study was to determine the most pleasing maxillary incisor inclination on the lateral profile and the impact of various lower anterior facial height ratios, both at rest and with smile, on facial attractiveness in an adult Asian male and subjects as perceived by different panel of raters. And we use a visual analog scale, which is the most common tool that we use. So apart from that, the null hypothesis was that there should be no impact of these various maxillary inclinations and facial heights. So the material matter is slightly complex, and I will try to explain the best I can. So the material matter, after approval from the ERC approval, so we had a 22 years old male subject after obtaining his informed consent. The inclusion criteria was obviously restricted to an orthodontic profile. A and B was within normal range. UISN was again within the normal cephalometric standard. Vertically, our subject was within the 55 range, which is the standard for Eastman correction or Eastman cephalometric vertical height. Apart from that, we also took the patient inclusion who had the normal soft tissue profile according to the Z angle and your E line, Rickett's line, right? So an ideal dental relationship was again a prerequisite. So the exclusion criteria was obviously any craniofacial anomaly or any surgery that would alter any facial structure would be eliminated. So the sample size that we calculated was with the help of OpenFA. So using the findings of Galibeta, who reported the mean visual analog scale at 10 degrees by orthodontist and layperson to be 62 and 49. So respectively, then we kept the power of the study around 80 with a confidence interval of 95. And finally, we had a total sample size of 66. And we divided into 3 different panel raters, which were 22 subjects per group. So Bayes suggested a method. We used this method to help you assume the natural head position so that the face was not tilted up or down. So this is a very reproducible way, and usually as an orthodontic resident or an orthodontist, when we take a profile picture in a lateral profile way, so we are actually following this way, which is quite reproducible, in which we have to see and guide the patient that the head does not seem to be tilted upward or down. So this is something we do and every orthodontic resident do in a common practice. So profile pictures were taken in natural head position in two separate poses. So for the first one was at rest, and second one was in which the lips was relaxed, and second one was the social smile, which is reproducible, and at least crown of the canine and the gingival outline margin was seen. So pictures were again taken just pictures was taken at a distance of 5 feet from the subject using the Nikon camera, and we use the Adobe Photoshop and the Illustrator to help us with the different modifications. So previous studies have established the guidelines in which they have elaborated how they have managed and done these alterations in quite some detail. So we will discuss some of them. So to delineate the changes in different incisor inclinations, central and lateral incisor crowns were sliced separately using the editing software. So this is something that you need a professional for that, and you need someone who is good with the Adobe and Illustrator, who can manage easily these things. So coming towards that, each tooth that we consider was central, lateral, and canine, and each was considered as a different entity, and we sliced it and so that one change does not impact the other tooth. So we have to slice the tooth entirely and separately and treat them as a separate. So since we just need a tipping movement, so we consider the rotation at the incisal edge because there is no root visible on that. So we considered and we rotated considering the incisal edge as the center of rotation. So coming towards to preserve the symmetry, the midpoint or major incisor considered lateral incisor. To again, the purpose was to preserve the symmetry in the vertical and the horizontal direction. We took two tangent lines in the incisor gingival line. We took the incisal edge as the horizontal landmark, and vertical landmark was placed mesial to the canine, so that we have a boundary, clear boundary that where we can give the different modifications. So a symmetry is preserved. So coming towards finally, after all these modification, we had total 7 final images with various maxillary incisor inclinations in a male subject, which were divided was one was a natural incisor inclination, 3 were lingual direction, 3 were labial direction, and this was progressively increased in a 5-degree increment. So this was the idea regarding the incisal inclination. So this article has 2 aspects. One was maxillary incisor inclination, and second was about the lower anterior facial height. So, okay, so how did we manage to do this inclination changes? So just to discuss a bit. So we constructed different lines. So if we can go through the figure, we can explain it a bit better. So yes, so these were the figures that we use. We use a horizontal aesthetic line, which is just an horizontal plane to have a good reference in a horizontal landmark. Secondly, we had a tangent line which was drawn from the incisal edge, touching the incisal edges for each of the modification. And lastly, what we took was the subnasal to the pogonion dash with the soft tissue, the most prominent part of your chin. So this was the landmarks that we took for the incisor inclination. Again, with the help of a professional who is good at doing Adobe work or Illustrator work, can help you with that quite easily. You don't have to do it yourself. So these were the landmarks that we took, and simply by putting the tangents at different inclination, we had different values for that, and we will discuss in the table number 1 shortly. So after correction these type of inclinations, we can come towards the lower anterior facial height. That how did we manage to do that? Okay, so again, two soft tissue points that I mentioned was subnasal and sublabial were chosen, and these points were stretched and depressed. 5 images were produced different vertical heights. The initial unaltered ratio was 55, as we have already mentioned in inclusion criteria. Then we actually stretch and depress these 2 points, subnasal and just below the lip. We stretch and compress these images by 2 millimeters or 2 standard deviation away or 4 standard deviation away from the Eastman cephalometrics. So these modifications were divided again for 47, 51 was considered low angle, or you can say short face, 55 was the normal face, 59 and 63 obviously would be considered at long face. So these modifications was again done at rest and on smile as well. So we had quite number of pictures we had for the raters to appreciate them. So however, to maintain the natural form to score accurately, we had to make sure that the contour of the face was not altered too much. So a slideshow consisting of the photographs with normal and altered incisal lower anterior facial ratios was shown to different panel of raters. Again, once we have done with the alteration, we provided a PowerPoint presentation to all of the raters. So each image was changed once the rater was satisfied with the assessment. This was just in criteria that we showed the picture to every rater and asked them to rate. Once they are satisfied with the rating, then we progress forward to another rating. So the visual analog scale was again 100 millimeter and uninterrupted line, and we asked the patient to indicate what they felt the most attractive and most unattractive. 0 would be considered the most unattractive profile, however, 100 would be considered to the best or the most aesthetic comparison. So again, to remove any bias or to make sure that the panel understands what we are doing, so we assess the inter-examiner reliability, and we asked 3 randomly selected raters from each of the panel to re-rate these after 2 weeks, and we also find out that the intercorrelation was found to be had a good agreement with a 0.79 score. So this angular measure we have discussed already. Coming to the data analysis, if we come to data analysis was quite simple. We just compared different panel of raters with the help of Crystal-Wallis test. So just to go through with the data analysis was performed using SPSS, and the descriptive statistics for the age was calculated. We also reported median and interquartile range for the VS scores. The reason for that we had a non-normal distribution of our data. So we had to report a median for that. So in all our through all our articles, we have reported median in our tables, which depicts that we had a non-normal distribution. So apart from that, if we go through the test, what we ran was number 1, the Shapiro-Wilk test to understand the normality of our data, which was non-normal. The Crusco-Wallis test was used to determine statistically significant differences among the panel of raters. Since we had 3 panel of raters, so we applied Crusco-Wallis test, and then to compare that which group had significant difference between them, so we had to apply Mann-Whitney test. So coming to the results are quite complicated, so we will just understand what is important. So the mean age of our raters was quite comparable. The general dentists, orthodontic residents, and the lay persons were within a young adult group, you can consider them. So the gender difference was not much great. So coming to the table number 2, the male, when we divided our data based on male and female to understand if the gender has any impact on the rating. So what we found that overall male raters preferred +5 degrees incisor inclination to be more attractive, a slight proclined as compared to females. However, females found -5 degrees to be more attractive. So this was a gender difference. However, a consensus was reached for the profile picture with normal facial height addressed to be the most aesthetic. And there was a disagreement when rating the profile picture with smile, in which male raters found -4%, which is slightly short-faced, and female found normal face height to be the most attractive. So this supports the notion that in male subject, it would be better that if you have a shorter facial profile or a normal facial profile would be fine as well. So there was slight disagreement between gender. However, there was no statistically significant difference was not found. So if we come on the basis of the raters, the general dentists appreciated -5 degrees, slightly less than the normal one to be the most important or the most aesthetic. However, the lowest was again given to the most retroclined incisor, which was -50. And then with respect to the lower anterior facial height at rest and with smile, all the raters found that the normal facial height to be very aesthetic. So if we see the trend was the same, each of the rater found lower anterior facial height 55% or slightly below, which was 47% to be the most aesthetic, if you put it in simple ways. And similarly, majority of the raters found -5 degrees to be more aesthetic in a male subject as compared to proclination or retroclination. So then we applied Crusco-Wallis test. So what we found that there was a statistically difference between different variables that we gone through, and then we applied the Mann-Whitney test to understand which group has the difference between them. So if we go through the tables, I think we can. So if you see the gender dimorphism within the raters, we can appreciate that the male and female raters has slight difference of opinion, but both appreciated the -5 to be more aesthetic by the male raters. However, female raters found slightly proclaimed to be more aesthetic. Similar story was the photograph at rest and on smile, that they all found normal facial height to be the most aesthetic as compared to others. Similar story was regarding with the different raters, and we just want to go through last. So comparison of the median visual analog scale among three panel of raters showed significant difference in -10-degree inclination, -15-degree inclination, and significant difference were found among the visual analog scale scores of the raters for +8 and for +4 at rest. So when we did the comparison between each group, again we revealed quite some difference. Again, this will complicate the. This is quite complicated, and there are a lot of numbers. So just to understand, overall, the normal inclination was found to be the most attractive, or the -5 would be considered most attractive as compared to normal. So this was the overall perception of our panel of data that we had. So coming to our discussion, the present study was conducted to determine the most pleasing maxillary incisor inclination on the lateral profile and the impact of various low anterior facial eye ratio at rest and smile on facial attractiveness in adult male subjects. So we rejected our null hypothesis, and we did find that there was difference between maxillary incisor inclinations, and there were difference of perception between different panel of raters, and smile did had an impact on the rater's perception. So several studies have discussed the impact of these features in female subjects. However, limited data exists on the effect of these variables on the male subjects. So we use an image of an adult male to eliminate any growth-related profile changes. So there was a difference in the visual analog scale score between genders when rating the maxillary incisor inclination in male subjects, but this difference was not statistically significant as mentioned in the results section already. So male raters preferred a slightly prominence in the maxillary incisor as compared with the female raters. This was also seen in previous study by Najafi et al. It is generally observed that masculine facial features such as well-developed chin and strong jawline are considered attractive in males, and therefore the prominence of maxillary incisor can be considered to be male dominant feature. So when considering the vertical dimension at rest, it was noted that the most preferred ratio was the normal facial height for both genders, and this was in agreement with another author on the sample of Jordanian population. However, in our study, male raters favored hypodivergent profile compared with female raters when considering lower anterior facial height on smiling. So on smile, there was slight difference, which was not statistically significant. So these were our modifications on the basis of different low anterior facial height on smiling. So similarly, we had our modification at rest. So these were modification were same and was shown to the raters to appreciate these kind of changes. Then we have a male raters assigned higher visual analog scale score to the profile photograph taken at rest compared to photograph. So one of the features that we found a difference that the female subjects found a male subject smiling to be more attractive as compared to at rest. However, male raters found the male subject at rest to be more attractive. Again, this cannot be statistically significant, but this was the finding that we found. So coming towards the panel of raters, so we have three panel of raters as we have already mentioned. So we found that all professionals were in perfect agreement with the most aesthetic incisor inclination, which was -5 degrees to the standard UISN norm. However, this is in contrast to the study in which orthodontist prefers 5-degree procline and layperson consider normal inclination to be more aesthetic in Iranian male subjects. So again, there can be slight differences between population and their perception. So in our perception in our society, we found that the -5 slightly retrocline incisor would be considered more aesthetic. So again, Ghalib et al. Conducted a study and they studied on a female subject and found that all raters favored a slight procline incisors, and these difference in the incisor between genders can be an important aspect in finishing the cases. So one of the study conducted by Ghalib et al. Found that in female, it would be better to have a slightly procline incisors. However, in our study, we found that the male can accommodate slightly retrocline incisors as well. So this can be information for the orthodontist when finishing the cases. So we can slightly put the incisor slightly retrocline as compared to females. Okay. So similarly, what we have found that we have measured different types of angles. So if we come towards the table number one, so these were the angular measurements on the lateral facial profile that we have measured. There were two angles that we measured. So if we see that the angle number one was formed between the tangent line, which was TG, to the HR horizontal, which was the aesthetic line, and the second angle was formed between the SN to subnasal to pognon dash to the HR. So the Ghalib et al., what they have studied, they found that the most aesthetic inclination that found was about 93 degrees, which was the angle TG to HR. However, in our study, we found a -5 inclination to be the most aesthetic. So this makes the angle 84 degrees. And if you see the tangent line, which was -4.0. So this was slightly difference between these opinion between different population. Okay. So again, in female subject, the Ghalib et al. I found the ideal inclination to be 93 degrees to the HR line and 7 degrees to the lower anterior facial height. However, we disagreed with that and we have a slightly change of results. So our results are in concordance with the another study which found that moderate to severe lingual inclination to be the worst in male subjects. Again, too much retroclination would be considered a dumping of incisor, which is considered to be detrimental to the facial aesthetics. So this was the same as which is already present in the literature. So coming to the last part, which was vertical growing pattern. So how we can control these type of different vertical dimension and always been an important part in treatment planning. And it has been agreed that the longer facial heights are considered more unaesthetic. However, variation do exist. So one study from Brazil actually recently conducted, which was I think published in American Journal of Orthodontics, concluded that it is not necessary to always consider long face as unattractive, as cultural and social norms play an important part forming the perception. In our study, we found that the orthodontic residents and general dentists agreed that the normal lower anterior facial height ratio is the most aesthetic at rest. However, layperson disagreed and found that slightly hypodivergent or a slightly shorter face to be the more aesthetic. And this is agreement with the study in which normal or slightly reduced vertical facial height considered the most attractive among different parameters. So regarding the most anesthetic lower anterior facial height, we found that orthodontic resident and the general dentist agreed that the most shorter face, the most like the short face, the -8% lower anterior facial height were considered the most anesthetic. However, layperson found the longest face to be the most least attractive. So this was a difference between our panel of raters. One found that the shorter the face, the greater shortness of the face would be considered as unattractive. However, one panel of rater that a layperson found that the long face would be considered more unaesthetic. So acceptance of the long facial vertical proportion has not been considered to be anesthetic as demonstrated by recent studies. So this actually supports the study from Brazil as well. That's not necessarily the longer the face, it's always the case that it should be considered anesthetic. So lastly, coming towards the last part of our article. So general dentist, orthodontic resident, and layperson had the same perception when evaluating the lower anterior facial height when scoring the smiling photograph as they did with the photograph at rest. General dentist and orthodontic preferred normal vertical proportions and layperson preferred -4 to be the best. So when we compare the aesthetic scores for lower anterior facial height ratio with smile and at rest, it can be concluded that a general dentist and orthodontic resident gave higher aesthetic score to picture at smile than at rest. So one of the last point of the article was to see that whether the smile had any impact on the facial attractiveness. So what we found when we saw our results, what we found that overall the result aesthetic scores were given higher when the subject was smiling. So this actually supports our idea that when you are smiling or your photograph is taken in a smile picture, so it is a good chance that you might look more attractive. So for that, we actually given a term which is called smiloflage and which I've used in our article. So lastly, we also report, again, this was not statistically significant. Just by viewing our data, we found that this was slightly different. So this also reinforced the notion that the smile can camouflage the lower anterior facial height to a certain extent, which might hold some clinical importance as smiloflage. So coming towards the limitations section, obviously this is a study in which we have done a lot of modifications and a lot of panel of raters were involved. Again, certain biasness can be incorporated in that. So we have addressed in the last section. So an important observation noted when reviewing the results of the similar study is that although the subjects included have incisor inclination within the cephalometric norms, their facial features are always different. And this can actually have an impact on the rating as well. So this is something a drawback, or you can understand that facial attractiveness or facial features of certain people can actually have an impact on the rating. So this is something or drawback in every study, subjective study would have. So lastly, however, this was again ethnic characteristics are again important. We have specifically focused on an Asian population which was available to our region, and again this cannot be applied to whole ethnicity or to the whole region. So lastly, coming to the limitation of our study include that unnatural distortion of the face was also there because of extreme modification and low anterior facial height, and there is a possibility of biased subjective assessment because different facial features. And our recommendation would be to assess different facial modification from the frontal and the lateral views in different skeletal patterns. So if we conclude our article, so the objective was to determine the most pleasing maximum incisor inclination on lateral profile and the impact of various low anterior facial ratios at rest and with smile on facial attractiveness in adult subjects. The conclusion were as follows: that all groups of rater preferred slightly retroclined incisors to the norm to be the most attractive. General dentists and orthodontic residents were in good agreement, and they found lower anterior facial height 55% to be the most attractive and increased facial height to be the least attractive with smile. So they had a different opinion on smile when the subject smiled. So they found that the longer anterior facial height was slightly less attractive. Then gender of raters did not have a significant influence on facial attractiveness score, as we have seen that there was slight difference between male and female. However, it didn't reach any statistically significant level. Then smile had the most influence on the perception of orthodontic resident and the general dentist. And lastly, smile had a camouflaging effect on the modified lower anterior facial height, which we used as a term as smiloflange. So this concludes our article. Questions, please feel free to ask.
Thank you, Dr. Shoukat, for your valuable presentation and taking the appropriate time. I also say hello to Dr. Mubassar Fida and thank him for his presence. I also pass it to Dr. Arab to hear her valuable comments. And after that, we are again with the dear authors for more discussion about this valuable article. Dr. Arab, I pass it to you.
Thank you very much. Thank you very much, our dear host. Your presentation was so invaluable, informative, and interesting. Particularly, it was in the field of aesthetics, which is my favorite one. I have one question. As I got it, when you change the lower anterior facial height, only the height of the chin is changed, and the height of the section between subnasal and the lower lip is left unchanged. Therefore, the ratio between subnasal stomion and stomion menton is changed. Therefore, maybe, just maybe, the reason that the raters have rated the lower facial height or the higher facial height, more unpleasant, is that their ratio has been changed, not the height itself. How do you justify it?
Okay, so when there was 2 points that we altered, which was subnasal and sublabial, as you mentioned. So the ratio was the ratio again when we increase the height of these two, only these points, when we depress and compress, the overall ratio was affected. Rather than if we increase the overall ratio, it was be very proportional. So the idea was a study that we have to produce a disproportional facial appearance. So we only increased this section, which had an impact on the overall ratio. So this was the, I hope this answers the question.
Thank you very much. I think Ali had a question. Yes, Ali, would you like to ask your question?
Yes, thank you so much, Dr. Arab. Thank you again, Dr. Shoukat, for your valuable presentation. As this is an important point, when the camouflaging effect of a smile that you call the smiloflage, it was a great finding. And I just had one question about your findings that when smiling, the smile has a camouflaging effect on the lower anterior facial height, and it can mask the problem of the lower anterior facial height. But in table 5, when we compare table 5 with table 4, comparing the VAS of orthodontists, when the lower anterior facial height is increased by 8%, at rest they give the point of 4.5. But when smiling, the same group gave the score 2, and it has decreased. But in the discussion, when I was reading the article, I didn't get the point that what is the good effect of the smile and what is the camouflaging effect of the smile, because in this comparison it has decreased by 2 points. I just wanted to ask these questions in order to clarify it.
Yes, it was a good finding actually, and when we results and our discussion, it was just suggested that smile might have an effect on that. But again, it was not statistically significant, and you rightly mentioned at the extreme modification, especially in considering the orthodontic residents, the smiling overall, the value did decrease. But overall, if you see the overall table, not mentioned the lower anterior facial height that you mentioned, yes, it did decrease, but overall in other variables, if you see for the -8 or -4, there was some difference. We cannot say for sure, and I feel that more studies should be done on that to understand that the smiloflaging effect was present or not. It was just suggested that it might have an effect on that. And yes, it was not. It is not very clear with these readings that it has a clear, distinct effect on smile. So this was a good point, and I feel more studies should be done on this particular term to understand whether this is actually a phenomenon which is present or not.
Thank you so much again. I'm waiting for the audiences if they have any questions, and I also ask Dr. Sukhia again and Dr. Mubassar if they have any comments for us, and we are all ears to hear their comments again.
Right. So thank you very much, Dr. Keshwar and Dr. Arab. So just to summarize that, like, as Dr. Umair said, that the smiloflage term, this was point just to looking at the table and the results in overall, like, there are one or two readings which are less, but mainly if we see the smile is camouflaging the scores. If we look at the scores at rest, they are less as compared to the scores at smiling. So that is why we just suggested this. And as Dr. Umair said, we need to go into further detail. Further studies need to be carried out to evaluate this as well.
Thank you. And I also have see another article that you have written about an Asian female. And yes, that was a great article too. And we will be happy that if we can continue these meetings, continue these journal clubs, and it will help us to get more knowledge about this worldwide trend aesthetics, and especially in cases when there is the dilemma between extraction or non-extraction regarding the inclination of the incisors. It will help a lot about for the practitioners to have the greatest treatment plan. I once again thank you so much for your presence, for your cooperation, and I also again ask Dr. Arab, Dr. Shoukat, or any other audiences if there is any questions, or if not, we can end the session.
Thank you very much, Ali. Once again, on behalf of the International Affairs Department, I would like to express our deep sense of gratitude from our host, Dr. Sukhia, Dr. Mubassar, Dr. Umair, for participating, and we hope to continue our cooperation in future. Thank you very much.
I also thank the International Department of Tehran University of Medical Sciences and Abbas team for their great support and organization. Thank you so much. Have a great day.
Thank you. Thank you very much, Dr. Keshwar, Dr. Arab. Thank you very much. We will continue such collaborations in future, inshallah.
It was a great honor for us. Thank you so much.
Thank you. Thank you.
Our pleasure. Thank you.
I think Yes, ma'am.
हाँ,
Yeah, no. I think उन्होंने मैम के पास आ रहे हैं।
इसके लिए कोई बात नहीं है।
मैम रिकॉर्ड है।